Welcome. This is Dr. Margaret Christensen. I am the host of the Toxic Mold Project, and I'm so excited to have Dr. Donald Dennis here with me today. Dr. Dennis is an ear, nose, and throat surgeon who has treated over 36,000 patients in his illustrious career. And he realized a number of years ago, in the past couple of decades, that he was seeing more and more complications of chronic mold exposure and fungal exposure and treating sinusitis. So he's developed amazing protocols for both not just treating the patient and treating chronic sinus infections and understanding how they're so intimately connected to brain dysfunction and whole body systemic dysfunction, but really also targeting how to treat those through the sinuses and also really addressing the home. So he's provided some amazing slides here, and we are going to walk through those. So welcome, Dr. Dennis.
Thank you for having me.
Yeah. So let's start with this, again, systemic mycotoxin management by starting with the sinuses. And if you want to go to your next slide. So just, again, kind of hit the bullet points here.
Yeah, just getting mold off the table with everybody first. So we do a tap test on their clothing and their nasal culture to see if they've got a heavy load in the house. And then we put them on environmental treatment and endoscopic treatment if they need it, and systemic treatment. So now the CDC in August of 19 finally came out and said mold should be considered on any chronic illness as part of the differential, which is a big breakthrough in organizing.
Wow, that's huge. I didn't know that. Wow. Okay, we'll have to look at that. Okay.
So that's big. So we're getting everybody to think about it at least. And this is a picture of you take a culture in the nose, you put it on the SDA agar plate, and you tap the clothes, legs, front, back, and now you got a total fungal load in the whole body. So then you know if the environment's bad. So if it's a home office or car or a combination, you got to fix it. And so
before you go on, Dr. Dennis, so what you are doing then when patients are coming into your office is you're swabbing their nose. You are actually directly swabbing one of the agar plates. And I know you use a company that I do too, it's called Immunolytics, but I've never done this on patients like this. And then you have them tap their clothes, or you actually take another plate and you're tapping their clothes themselves.
Actually, I put it all on one plate, but you can separate it if you want. It's just, I'm just trying to get total load. You know, okay. Is this patient got a lot of fungus or not? And if it's on their clothes, it's going to be in their nose, you know.
Okay.
So, and if they have a large number, the normal would be 0 to 4. If a lot of them have 50, 60, or 100, or two numbers to count, and then you know which the genuses are, and through that you know probably where it came from.
Okay, and so you need to, and those have to sit around and grow for about 3 days.
That's right.
Yeah.
And then we, once they grow, we send them into Immunolytics and they do the test.
Fabulous.
And when the patient comes back in, then we've got this total and say, okay, you've got an environmental problem. No question about it.
Can you show the next slide that shows that?
Yeah.
Oh, yeah, this is really important too.
So the air you breathe is 5 times more important than all treatment rendered by hospitals, doctors, or medication. And you need to read that about 100 more times, because nobody gets it even if you read it 100 times. They're focused on the pills and the surgery and the cleaning and all this. If you don't get the air right, it doesn't matter what else you do. The load is too high to overcome with medication or surgery, so you got to focus on it. And the second one is the air is twice as important as your genetic code. You can't fix your code, but if you fix your air, you did better than twice fixing your code, which is pretty outstanding. And then nearly 60% of all preventable deaths are due to conditions at work and at home in the air. So air is the big deal.
So yeah, wait a minute, stop. Let's go back to that for a second. Go back to your previous slide. So we are recording this right in the middle of the COVID epidemic. And one of the things that is not really being talked about in all of this is how the role of air pollution and, again, toxic mold exposures also, which are so frequently common, have already compromised everybody's immune systems. And especially the cities where we're seeing some of the big death numbers are moldy cities and they're polluted cities. You want to comment on that?
Well, the moldy cities and high humidity cities are going to be the ones that have the most mold growth environmentally in the homes and everywhere else. And so if you've got a high level of mold you're breathing, you're going to depress your IgG subclasses. So your immune system is going to be suppressed. So you're going to be more likely to get whatever's being passed around. And you're not going to do as well as somebody who doesn't have that kind of an environment.
Right.
Unless your genetic code protects you, which is the case with a lot of people. But even if you have no symptoms, the mycotoxins are destroying your system slowly without a symptom. You'll have some fatigue, and that's about it.
All right. We'll go on to your next ones. You've got such amazing information.
So antigen removal is the single most important step. So removing the mold from your air and your body is key. If you don't get that right, no medicine works. So you got to focus on that first. And the particle count, with a particle count, needs to be less than 50,000 at 0.3 microns. And now those things are available for $200. They used to be $2,200 to get a particle counter. So you can get a particle counter for your house and find out, what your count is.
Okay, and those are available like through places like Home Depot or
Home Depot or Granger.
Okay.
Or just Google particle counter.
Okay.
So they'll pop up. It ought to be on your thermostat. Really, it ought to be integrated.
Okay.
But that's coming. Then the mold count with that gravity plate needs to be 0 to 4 colonies for regular people, but the severely sick have to have 0 to 2, which is hard to do, but it's possible if you do the right HEPA filtration and get rid of carpet. Carpet is not negotiable. You got to get rid of it. You can't have carpet.
Carpet and drapes too. A lot of drapes.
Yeah, drapes. Now this slide's important because the picture on the left, this is a very clean room, no problem, right? Well, the mold counts are the same in both of these rooms. So it doesn't matter what a room looks like because you can't see spores, but these have grown so you can see them. So just because it looks fine doesn't mean you don't have a problem.
Yeah, so in other words, what you're saying is that this slide that's on the left looks like this very nice study. It may not even smell musty or moldy, but there can be hidden molds, and this one is growing a very high count on the plates, as much as what you're seeing in this clearly severely water damaged building.
But both of these are two numbers to count.
Yeah.
One with water damage and one with no visible water damage. So this slide is important because all the mold in the environment enters through your nose. And so the nose is a filter for the lungs. So inside the sinus membranes in the nose, the colony that counts for spores and the mycotoxin levels and MVOC levels are the highest concentration in this mucosa. Well, it goes straight up the olfactory nerve into the brain. And that's why you have psychiatric symptoms and all the neurological symptoms like ringing in the ears, visual disturbances, hearing loss, balance disturbances, weakness, muscle atrophy, tremors, memory loss, concentration problems. All those things are caused by entering the brain. And so think of it like people used to sniff glue to get high. Well, mycotoxins are the glue, and the fungi are the factory that make the glue. So you've got to get the fungus out of the sinuses to stop contaminating your brain. And that's what most people don't understand.
Yeah.
So you can have a negative CT scan and still have high levels of mycotoxins in the mucosa that has to be rinsed out. And to do that, you have to do endoscopic surgery to do that, but it's not a big deal.
Well, so I know that you've got a couple of slides coming up on the endoscopic technique that you use, looking inside people's sinus cavities and actually irrigating and rinsing them. But before we get there, let's talk about some of the next things. So but before you move on this slide, so let's just recap. So what Dr. Dennis is talking about is that we have our olfactory bulb, which is our very oldest actually smelling sense and nerve in the body that is directly connected through the olfactory nerve into the brain, and it goes right by the pituitary gland. Dr. Dennis, perhaps you could point out where the pituitary gland is.
on this slide, this is a sphenoid sinus, and the pituitary is right here. So it's part of the brain.
Yeah.
And it's got candida receptors in the pituitary gland. So a large percentage of these patients get pituitary damage and therefore hormone dysfunction of the thyroid, cortisol, and human growth hormone. And if you don't fix that, especially growth hormone, you can't mount an immune response because you can't make new cells. And the IGF-1 is a measurement of the growth hormone in humans. And that number in a lab is not accurate to say that just because you're in normal range doesn't mean your growth hormone is okay. Because over 53% of the people with, quote, normal IGF-1s cannot make growth hormone and have to have injectable.
So
that's
again,
huge.
So what Dr. Dennis is really saying here is that the part of the brain that's called the pituitary gland, which really controls all of our hormonal functions, is actually attached to the hypothalamus, can be directly affected by chronic inflammation in the sinuses. And that's why we see so many hormonal disturbances and hormonal disruptions, both in women and in men with chronic toxic mold exposure. All right, show us the next one.
Okay, this is a patient that flew on an airplane and she got cognitive dysfunction, and I put amphotericin directly into her sinuses, and then she sort of woke up in about 10 minutes, her brain came back. And so this is a picture of the brain. This is a QEEG of a patient just like that. And the red is the brain damage on the QEEG. And then this is 30 minutes after putting amphotericin into sinuses. All this stuff went away. So it's pretty dramatic. Now, of course, it comes back in about 2 hours unless you fix the air or keep doing it.
Right. So what we're seeing here is, again, this imaging, which really shows a lot of where brain inflammation is happening. And you're saying that the one that we're seeing here on the left with all the red on it is the very inflamed brain, again, coming in through the sinuses. And then once you've treated the sinuses with the sinus irrigation protocol that you're using, and using amphotericin, which is an antifungal, you can see how immediately it clears up.
Right. Now, this patient had surgery before, so I could put amphotericin in all her sinuses in the office without surgery.
Yeah.
But if you hadn't had surgery, it's and you nebulize, it improves, but it doesn't get rid of all the red till you really actually irrigate all 8 of them.
Okay, so we'll go ahead to the next one.
No, this is just showing how we protect ourselves. We fog the patient and put gowns on. I put a gown on.
So Dr. Dennis, so for some reason I'm not seeing your slide. There you go. Okay, go ahead.
You got it?
Yeah.
All right, so this is a picture of how we gown up. We've actually fogged the patient. I can show you a video of that in a minute.
Yeah, no,
And
I've
then
seen
we,
that.
and then we put gowns on. I put 100% oxygen on. This is if a patient's been in a mold environment. Now they have a protocol of bathing and all that before they come in, but still, they'll still have mycotoxins. And so we just protect the patient in the office too.
Right. Okay. And we'll come at the end. We'll talk about fogging. So
at the end, these are all videos that we'll go to over at the end.
Okay.
Okay, so this is just an endoscopic picture. This is a big candida infection. It didn't respond to medication. This is the environmental air of that patient. And this is after we fix the air, then this is a light reflex, but all the sinus, all this stuff here is gone.
Okay, so can you point out on the left-hand side, what is the candida? What's light reflection?
The candida is all the white stuff.
All the white stuff. Okay, so all that white stuff. So that's not a light reflection. That's all that.
No. See, this right here is a light reflection. This is candida here.
Okay.
And so over here, this is a light reflection. All this mucosa here was this here. So this is all that's gone now.
So what we're seeing here is on the left side of the screen, where the red arrow is pointing, you can see that all that mucosa is very white, and that's candida or fungal overgrowth. And that's what we're seeing with recurrent chronic use of antibiotics. People get sinus infections and they get another set of antibiotics, another set of antibiotics, another set of antibiotics, and they're getting all this fungal and candida overgrowth as well as breathing in mycotoxins.
Right,
It's
and
just
then
so
you get the
frustrating.
same thing if you use a antibiotic nasal spray for a long time without antifungals, you get the
Right.
same thing.
Right. So you have to use both antifungals as well as antibiotics. And you described a little bit about sinus pitting that the mycotoxins cause. Do you want to kind of go and
Yeah, this is the
do you have
pitting
another
slide.
picture of the body? Yeah. Okay. Great.
Okay, so this is a biofilm.
Uh,
It's composed of,
okay. All right. Yeah. There you go. Okay.
you see it?
Yes. Uh huh.
Okay, so this is a biofilm inside the sinuses, and this is composed of mostly candida. So the biofilm is formed by an immune reaction to fungus. So when the fungus hits the mucosa in here, the eosinophils come in to destroy it. And when they do, they rupture and release a major basic protein, which puts an indentation, a pit in the lining, and that pit gets full of mucus and the cilia are destroyed. So it's like you can't flush your toilet. So these pits become the lath for building of a biofilm. So if you treat the cause of the pits, which is the fungus, then you don't get recurrence of the biofilm. But if you just treat the bacteria, it comes right back as soon as you stop using the antibacterial spray. So you gotta treat the fungus because that's the reason the pits are there, and that's the reason the biofilm's there.
So in other words, what you're saying is that the mycotoxins and the fungus themselves actually disrupt the lining of the sinus cavities, creating these little pits. In the pits is where the bacteria and the mucus response and the immune system response happens. A lot of bacteria are collected. That's what causes the infections that are bacterial, but just treating them with antibiotics doesn't get the fungal component. And so you have to do both. Now,
That's right.
Yes.
So it's the immune reaction to the fungus that causes the pit. The eosinophil is coming after the fungus in 20% of the population.
Okay.
So,
and then and this picture on the right hand side, is that a little polyp hanging down, or is that just part of the regular septum?
right here.
Is that part of the turbinates?
Right here.
Yeah.
That's a turbinate.
That's a turbinate. Okay.
Yeah.
And so I know that many people have had turbinate surgeries where they've had their turbinates removed. And that just...
Well, you don't want to do that. You just want to shrink them down.
Right. Yeah. Yeah. That seems like a really radical, because the whole point of the sinuses are to filter the lungs to filter the air before it gets to the lungs. And so when we're doing these turbinectomies and people are having, I've had clients who've had 4, 5, and 6, nasal surgeries of some sort. And, I realized it's like, where's the mold? And it's just appalling that most ENTs know nothing about this, know nothing about mycotoxins, and, are just still treating only with antibiotics.
That's right. So we can go. The antibiotics and steroids is just the standard of treatment, and nobody uses antifungals. So they need to start using them, and then you won't need as much antibiotics. Very infrequently do I have to use an oral antibiotic. Most of the time I can treat it in the nose itself with an antifungals and antibacterials and washes with and SSKI or Citra drops, in saline. That's sort of a broad spectrum natural antifungal, viral, and bacterial. All right, so this is a slide of the sphenoid sinus that's right below the pituitary gland, and this is a fungal mass in the sphenoid sinus. The reason it's fungus is got this little white stuff in there, which is calcium deposits, which fungus lays in. So then it's not just a polyp. And this is a fungus ball endoscopically inside the sinus, and this is the patient's environmental air. They're totally full of mold. So this is an obvious case that needs surgery. And this is another obvious case. You get a big aspergillus fungus ball in the ethmoid sinus here, surrounded in yellow. And this is a picture of how much fungus was in there. And it was very close to the brain. And this is after we got it all out. So you could actually have a CT like this with no visible anything. Everything's clean, and still have it full of mycotoxins, because you can't see mycotoxins or MVOCs or spores on the CT scan. So if we look at this one, this CT scan is normal except for this one little polyp here. But if you look closer, it's not just a polyp. It's got a little white dot there, which is a calcium deposit. So it turns out it's a fungus ball. So we take that little piece of tissue with the fungus on it, put it in an SDA agar plate, and in 3 days, we get a brown halo around it where the mycotoxins are leaching out of that tissue. And it turns out to be 0.28 parts per billion of trichothecenes causing the neurological symptoms in this patient. So this patient had all the medical treatment that you're supposed to do, but wasn't improving, and the sinuses weren't that bad. So once we opened the sinuses and got all this mucosa cleaned out and irrigated and suction clear with antifungals, then their neurological symptoms markedly improve. That's the point here.
Yeah, and that's just absolutely amazing. So, again, just watching the mycotoxins leach out. I remember the very first time I saw this slide when you spoke a few years ago, I was just like profoundly appalled. And so even if it's small polyps or whatever, should surgeons
so in
send
reality,
for mycotoxin testing?
That's one polyp there. But I can take this mucosa from the normal side and lay that mucosa in there, and you get the same thing.
Right.
So because all the mucosa is full of it.
And so do you routinely send these specimens then for mycotoxin testing, or?
Well, we don't do it on everybody because we already know the urine's positive.
Right.
And so there's not going to be a situation where you have positive urine and you don't have a positive mucosa because it came into the nose. So the nose has got the highest concentration, but on a lot of them, we still do it. But after, the first couple of hundred, and everything's positive, you don't have to keep doing it. But unless the patient wants it, we do it.
All righty. So, I need to find a local ENT who is going to really wake up to this. Yeah. And so Dr. Dennis has some really wonderful articles that he sent me, and we will make those available as part of the bonus gift from Dr. Dennis. All right. Well, keep on going because this is so fascinating. So
this is a close-up just to show you. This has no brown halos, right? Normal tissue, no brown halo. So do all tissue have brown halo? No. This is the normal one. No trichothecenes. See? Okay. You can have aflatoxin too is in the brown ring. But this is just to show you all tissue doesn't do this, right? That's the control.
Got it. So what you're saying is that, you can really see the difference between somebody who's full of fungi and mycotoxins versus normal tissue. Okay,
so this is I'm going to show you some videos, but this is a patient 3 days after endoscopic surgery, washing out all her sinuses with voriconazole in her case. Drastic difference in appearance.
Right. Oh my gosh. Yeah, you can see that. Yeah.
Totally toxic here.
Yeah.
This is 3 days after surgery. It's pretty amazing.
So the surgery you did with her was to remove the what surgery did you do?
What you do is you under the endoscope you go in and you open all 8 sinuses, and then after you open them you irrigate them with this thing called a cyclone, which you're going to show you in a minute.
Okay, you're going to show that.
And it's got amphotericin or voriconazole in there, and it sucks and irrigates at the same time. So we literally can wash out every millimeter of all 8 sinuses, 360 degrees, and suck the mycotoxins out at the same time so they don't go anywhere. And that's what makes the difference. And I'll show you this slide later. Okay, so this is just some more plates with the same thing. Okay. Aflatoxin. And I'll show you this guy later. So this is just a summary of what you have to do. Clean the air.
Why don't you go, go ahead, go through that.
Get the mole off the table with the tap test. The highest concentration is going to be in the nose and the sinuses. Evaluate the pituitary gland to make sure the IGF-1 is normal. And if it's not, they need to get a insulin tolerance test to make sure they can make it. If they can't make it, they have to have injectable.
Mm-hmm.
And you can try Somorelin on these people, which is growth hormone releasing factor in a drop under the tongue. Brad
Mm-hmm.
makes that, and then wait a month or so. If IGF-1 doesn't go up, they can't make it. So you know how to lower the air with HEPA filters, EC3 fogging, and laundry. Use saline nose washes, citral drops, amphotericin, and nebulization to all these patients. And then the most common reason for failures, we can go over this later, but washing out the nose and using some of this stuff.
Okay.
And let's see. You got to get in a safe environment first, and this is just the points of.
Okay. Well, actually, wait a minute. Let's go back to that slide you just showed.
This one.
Just the previous one, yeah. Again, so this is especially for people who are super sick, who have neurological symptoms. You want to get out of the environment,
right,
and into a safe mold-free environment.
And how do you do that? Well, you pay attention to how is the air when you first go in a new place. Does it feel clean and fresh, or is it heavy air and does it have odors? If it's heavy air and odors, it's a no. You're done. You're not going to look anymore. And then once you find one that you feel good in, you stay there for a few days and make sure that you're improving in that environment before you rent or buy. That's how you do it. And then you do the testing, but you don't bother testing unless you feel good in that environment. It saves a lot of time.
Right. Okay. And that makes sense. And then you get assigned a CT scan. Of course, you're an ENT, so you're going to get that on anybody anyway coming in. And
you got to get a CT scan just to evaluate. Do they really have a fungus ball in there that needs to come out? Mm-hmm. And then if it does, you got to take it out surgically. You can't get rid of a fungus ball with pills.
Right. And then, and I know you've checked urine mycotoxin levels and have for a long time. I know you have a relationship with Real Time Labs and Dennis Hooper, who he interviewed in our bonus section to test people. But one of the things that you said is that it's whatever is in the urine, you're beginning to find 10 times higher in the mucosa of the sinuses, and that's why we're seeing all the immune system dysfunctions that we're seeing.
And the psychiatric problems and the neurological symptoms, especially cognitive dysfunction, almost all of these patients will tell you they have that.
Absolutely.
And so if you don't get it out of their sinuses, you're not going to get it out of their brain.
Right. And then you like to do O2 face mask. Is this just when the people are in your
Well, what we do is get a home oxygen concentrator.
Uh-huh.
You have to get one that makes 10 liters a minute. The Vilbus Defend model is the least expensive one that does this. And so you use it 2 hours a day because it opens the capillaries. All these toxins are caustic. So in the capillary wall, they slam it shut with inflammation. So all the IV stuff doesn't reach there. So once you add oxygen, everything starts working. You get rid of the toxins much faster with oxygen than without it.
So with these home oxygen concentrators, do you have people purchasing them, or?
Yeah, they buy them because it has to be a 10 liter a minute machine, and usually the ones that respiratory companies rent are 4 liter a minute machines for people who have end-stage lung disease, and that won't work. It's got to be a 10 liter a minute machine, and you don't want to use one because you don't know where it's been.
Right.
So you back this machine up to a HEPA air filter, preferably IQ HEPA air filter, and then everything coming in that filter is clean. So you got clean air in there.
Okay, well, great. And then we've had plenty of people talking about detoxification pathways. So why don't you go on to your next one?
So when you talk about detoxification pathways, that's important. But if you're in a moldy house, it's not important anymore.
Right.
It's not going to work. Okay. Okay, so this is all the stuff we use basically. It's just a grocery list of what we give people.
Yeah, and you use also intranasal glutathione.
Well, we give an oral pill. They can have a nebulization or a IV or whatever. We use acetyl glutathione as a pill most of the time, or it can be liposomal. It doesn't matter.
Okay, yeah, and so we have. Wait a minute, go back.
So these are all the things that we do.
So we have folks who are talking about again the gastrointestinal issues, and we have Dr. Jill Carnahan addressing that. We also have Dr. Amy Kapadia talking about SIBO-CIFO, and again the intestines are so important. Vitamin D is critically important to improve the immune system. Again, we've had the importance of testing all the hormones in the pituitary axis, and so we have folks talking about that on the summit. And then and you don't use binders that often because you're going right to the sinuses. Is that what you're saying?
Well, I use it a little bit. I don't, for the most part, I don't need them much. I use zeolite sometimes or diatomaceous earth, but especially a lot of these people have motility issues because of the neurotoxins getting into the nerves that move the bowels, and you got to give them a oral antifungal. Now, there are 3 ways to do it. You can start them with amphotericin capsules, 250 milligrams, twice a day after food, and that will get rid of most of the fungus in the gut, but it doesn't penetrate. It stays in the gut. It doesn't go anywhere else. Amphotericin is not absorbable in the gut.
Really? I didn't realize that. Okay.
No, so that's why you can give 250 milligrams. If it was absorbable, it would knock their kidneys out.
Right.
So it doesn't do anything to the kidneys because it stays in the gut. So it's safe in the gut. But the other thing I like to use, because it goes systemically, is either Sporanox or Voriconazole. You get some spectacular brain results with Voriconazole because it goes into the brain better than Sporanox does. And that's 200 milligrams twice a day.
How are you? Do you get people's insurance to cover this? Because Sporanox is real hard to get insurance to pay for.
If you've got mycotoxicosis and therefore a fungal infection because you've got mycotoxicosis, right?
Right.
So then those 2 codes usually they do pay for it.
Okay, mycotoxicosis, and what's the other code?
Fungal, fungal disease, because it's in their sinuses if it's in their urine. So they have fungal mycotoxicosis.
Okay, and you use real-time labs.
I use both of them real time in Great Plains.
Okay.
I use both of them. Okay.
Great.
It's nice to have a choice.
Yeah. Okay. Well, this is
the thing about
information for the practitioners who are watching this. This is like this is gold. And
Great Plains labs won't do tissue.
Right.
So Dennis does tissue and everything else I send him. So that's the benefit of using him. And you can tell him exactly what you want him to test, and he'll test it.
That's fabulous. Yeah. So we have both Dr. Dennis and Dr. Shaw from Dr. Dennis is from Real Time, and Dr. Shaw from Great Plains Lab speaking in our bonus section. Great. So we mentioned all of these things already, and the next one.
Okay. This is everybody needs to copy.
So Dr. Dennis, here, what we'll do here is a pause here, and let me just do a reintroduction because this is where we're going to do the bonus material. So I'll just say, hey, this is Dr. Margaret Christensen, host of the Toxic Mold Summit, and we are talking with Dr. Donald Dennis, extraordinarily a brilliant ear, nose, and throat surgeon who has done tremendous work on the problems of mycotoxicosis, mold toxicity, and systemic and brain inflammation. And we are in the bonus section, and we're going to go through for patients who aren't getting better, what we can do here.
Okay, so
go ahead. Mm-hmm.
All right, so this is the most important slide because large numbers of these patients have been to multiple doctors and good doctors, and they're not getting better. And so this is your check, this is your work list. 90% of the time they're still in fungus, either knowingly or unknowingly. But the reason it's important is because at least most of them react 9,000 times normal. The ones, especially the ones that have sinus issues. That's a huge number, 9,000 times normal. So how much do you need for those people to get sick? Tiny amounts. So if you have neurological symptoms, like your brain doesn't work, you've got tinnitus, vertigo, weakness, tremors, those kinds of symptoms, you're not going to be able to fix your environment that you got those in and get well, because you're not measuring what's making you sick. What's making you sick is the MVOCs and the mycotoxins, which will penetrate through sheetrock and go through sealed plastic bags and go into wood furniture. And so you've got to move and not take anything with you. That's pretty drastic, but so is a neurological symptom. It's pretty drastic. So if you've done all your stuff and you're still in the environment that made you sick, you've got to move and not take anything with you. That's the message. If you can get that one thing right and move into a place that you know you're getting better in, there's no doubt in your mind, I feel better here, then that's when you start testing the place. And sometimes it takes 2 or 3 days to make that decision. So you have to rent it, by the date until you can find out, is this place safe for me? That means no carpet. It needs to be a newer place between a year and 5 to 8 years old. And it needs to have no fiberglass in the duct system, which is really hard to find in Florida. So if you find a place you feel good in, you can get all that stuff done later. And then the second one is sugar. A lot of these people are eating grains and they have a cracker or something. If you eat any sugar, you can't ever get better because you change the shape of the fungus. It turns into an invasive hyphal form, which is resistant to all antifungals. So you could take a candida, let it grow out on the SDI agar plate, and put an antifungal directly on top of it, and it won't work because it's got a sugar source. It's pretty dramatic.
That's pretty dramatic.
So when you put it right on it, it won't kill it.
Right.
So you have these patients who have this history. Oh, I'm on voriconazole, Sporanox, Doptecan, all the naturals, and nothing's working. Well, guess what? You're eating it, and you just got to go through your diet. It's got to be a meat, a seafood, a green vegetable, or a berry. And if it's not one of those, you can't have it, basically. Then you got to address the pituitary. The IGF-1 blood test for growth hormone is not normal. So if you take that test and you do the IGF-1 and you look at the normal range, say it's 5 to 10, then you add those two normal ranges together, divide by 2 for the mean. And if it's under the mean, you have a 53% chance you're growth hormone deficient.
Got it.
That's with a normal IGF-1.
Okay.
Okay, so that's how you quickly say, am I likely to have the problem, yes or no? Just do the mean. If you're below the mean, you probably have it. Then you've got to go get tested. And insurance will pay for injectable growth hormone if you fail an insulin intolerance test.
And there's actually a lot of other ways to do it too, because we have Ray Solano talking about nasal peptides. And so one of the ways that we can actually raise growth hormone actually is through nasal peptides without injections. And there's different ways, but that's a whole nother discussion to get into. So basically you're looking.
So now remember, the peptides are growth hormone releasing factor. So if the gland's damaged, that's not going to work.
Yeah. And there's other, but there's a lot of other peptides that are that indirectly help work, and including RG3, synapsin, and BPC 157, which helps with some of the repair. But so some of the other things that you're going after then is depressed immune system, looking for heavy metals, again, looking for genetics. We have folks talking about all of these things. So let's go on to let's slow your slides. Okay, so this is mentioning about how IGF-1 was normal in almost all growth deficient patients. And growth hormone is incredibly important, again, for healing, for anti-aging, for stimulating the appropriate parts of the immune system to function right. And when we don't have enough of it, we're more likely also to get diabetes, again, age rapidly, et cetera. So that's a whole separate discussion. Let's stick with the sinuses. Yeah.
Okay, so this is the pituitary.
Yeah.
Okay, this is just your aflatoxin. All the which moles the aflatoxins come from.
Right.
And then this is the conclusion.
Yeah.
Now, what I'd like to do is show some videos.
Yeah, this would be amazing.
And so the videos are going to be important. And so we'll go over here. And so we're going to show some befores and after.
Dr. Dennis, just so you know, I have a hard stop at it would be noon your time, 11 my time. So I want to keep going right up until then.
Okay, so we're going to be able to do this. So this is the slide. This shows the cyclone at work inside the sinus.
Wait a minute. I need you to make this full screen because we're seeing all your desktop too.
Okay.
There you go. Okay,
you ready?
Yes.
Okay, so this is inside the sinus.
What we're seeing.
Cleaning out the sinus. This is the device called a cyclone. And this is a suction here, taking it away so it doesn't go anywhere. And this is 5 ports in that is rinsing it out. And you'll see how fast that sucks. It sucks out really quickly. So it doesn't go anywhere while it's irrigating. And
okay,
this is how it works at the end.
So go back to the very beginning. And kind of, again, just describe, maybe you can pause it for a second and you can describe what you're doing here.
So what we're doing is we're irrigating. This is the opening that you made in the sinus. And so we are putting this instrument inside the sinus, and this is able to irrigate 360 degrees around at the same time. And this device here is a suction. So it's sucking out the toxins as you're removing them from the mucosa with an antifungal like amphotericin or voriconazole. So that's what's coming out of this thing. And so we put, in each sinus, we put 120 cc's through there, which is a lot.
Yeah.
And we do it under pressure. So we're irrigating all 8 sinuses, and all the toxins are coming out. That's why we get such dramatic neurological improvement after this.
And so the patients that you showed us in the previous video of, again, the woman who looked so much better just, 3 days after her surgery, and the gentleman who had a resolution of his tinnitus and hearing loss of 10 years, this is what you were doing. You were doing this sinus irrigation using the antifungals and sucking out all the toxins at the same time.
Exactly.
Yeah.
Exactly.
And just
so remember the highest concentrations in the sinus. So you've got to open the sinus to irrigate it.
Right.
Well, in nature, they're closed.
Uh-huh.
So you've got to make an opening. So that's why you have to operate on them.
I got it.
Okay. So you want to see the rest of this?
Yeah. Let's see what other videos you got.
Okay. So this one, let's see. There you go. So we'll do another one. This is the guy.
I guess that I've been brought out of anesthesia for about 20 minutes now. The first thing I noticed as I came to is my hearing has improved drastically. I could hear the conversations in the room next to me. I'm still trying to determine if the tinnitus is completely gone or just mostly gone. The ringing is obsolete in my ears. I haven't been able to hear this well for at least 10 years, at least. Although once, could you repeat that part to me? I'm not feeling that right now. And I'm still doped up like a zoo elephant.
Okay, well, that's great. That's good. So this gentleman, this was just minutes after having his sinus rinse surgery. Is that correct?
Right. And then this is a patient, the audio version. She didn't want an image on here. So we'll do the audio.
Okay.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
That is just an amazing story, and one that absolutely speaks to my heart because of one of my children has severe psychiatric illnesses, and I know that it's been toxic mold exposure and chronic infections. And, unfortunately, it's been a situation where it's beating my head against the wall with my psychiatric colleagues to try and change the outcome. And so I just applaud you for that. Do you have the one with the guy with the tremors?
Yeah, this is a good example.
Wesley Baker, 6/25/18.
Can you turn it up a little bit?
Of the arm and some leg tremor as well.
So that's a leg tremor, and then this is a post. A little bit different, huh?
This is after treatment of mycotoxicosis.
So that
Wesley
one,
Baker, 6.
that way.
Wow. And so again, this was just doing the same sinus rinse surgery that you had demonstrated to us.
That's right. So that all we're doing is just getting rid of the fungus.
Okay. And then, do you want to pull up a slide that you can talk a little bit about nebulized, or the other thing is, why don't you just stop share screening? Stop.
I want to show you a couple more patients.
Okay, sure.
This is
This is Tim Green, fibromyalgia, muscle weakness. Now go backwards and then sit in the chair.
okay. So that guy's not going to get better in his house. Okay. So
Right.
We get him to not take anything with him.
Okay, we can't hear you.
This guy is not going to get better in his house.
Uh-huh.
He did everything he can do to the house, and it doesn't work. So he had to go, not take anything with him, move to the beach. And this is what happens when you do that.
Hi, I'm Tim Green. I'm now living on the coast of North Carolina, and I'm living right here on the water, where there's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's a 0 mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. And now living here where there's a 0 mold count. I'm healthy, I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
It's amazing. Yeah.
So there you go. So now this is one more here.
This is Jennifer Parrish, who had a severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins.
Okay, so when you have a patient like that, they're not going to get well in their environment. I don't care what you do to it, it's not going to ever happen. So she moved out, didn't take anything with her, and this was about 6 to 8 weeks later.
This is Jennifer Parrish on 11408. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Go back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back, and her neurogenic bladder is over, so she can urinate properly, and she had a mass around her spine, which has gone away. This is all on Sporanox and vitamin supplementation, and her vision's coming back while they're chelating her for heavy metal. Jennifer.
This is the best this guy can walk, okay? That's the best he can do. All right, so this is, he does everything known to man to his house, takes every pill you can take, nothing works. So he leaves, doesn't take anything with him, goes to the beach. This is what happens. A little better, huh?
Yeah.
Okay, here you go.
So how do you find houses at the beach that aren't moldy? Because
it's a process, but you can tell usually when you go in it for a little while if it's going to be all right.
Okay.
But we tell them how to do that.
Got it.
Usually you know, okay, I'm getting better in here. Then now he's totally well now, right?
Right.
He comes back to see me 30 days later, 30 minutes in a moldy rental car, and look what happens to him. He's almost like he was before. See?
Yeah.
Okay, now tell me what happened to you.
This is a direct reflection of having mold exposure today.
See, today.
Right. Wow.
So that answers all the questions. Can I stay in the house? No. You know, if you want to get well, you can't stay in the house. And the only other ones are this is how to fog a room.
And you can see there's no carpet on your floor.
No, there's no carpet anywhere. Yeah. So that's a fogger. And then this is how we treat the gowns. This is EC3 that we used to do this with. And then this is how you fog a person. You can actually breathe this stuff. It actually works.
Mm-hmm. Well, and this is a botanical citrus-based fog. Is that correct?
It's called EC3.
Yeah.
And you can actually drink the stuff. It won't hurt you. But it actually makes you feel better.
Yeah.